My name is Amanda Dotz. Our daughter is 14. Her name is Mikkel. And she was born with my husband's ears. She looks quite a bit like him. And while he grew into his, she was not growing into hers. And so even when she was born, my dad had asked me if we'd ever think about addressing her ears, because kids can be cruel. And he didn't want that for his granddaughter. And I kind of put it in the back burner because I never noticed her mentioning it, trying to cover her ears, until she did. And she was in middle school when that started, but before that, hair back and ponytails and pigtails and not a care in the world. And then when she got to middle school, it became clear that she was more self-conscious about it. She wouldn't even put her hair up to play volleyball. And finally I worked up the nerve to try and figure out how to address it with her. And we had a gentle conversation about it, and she said I didn't know that I could do anything about it. I was just planning on covering my ears. And so we started doing some research. A friend of ours brought her son here for a minor procedure, and she's very particular about doctors. She's had some bad experiences in the past with her son and a broken leg. And so I trust her implicitly. And so when she highly recommended Dr. Weber and this firm and the support staff, I didn't even look any further. I did look at 3 other practices and met with 2, but this one, especially with my friend's recommendation, was easily the front winner. The onboarding, if that's what you want to call it, the administrative staff, very professional, very warm, very caring, capable of sharing their own experiences with children my daughter's age, that they had similar experiences. And then actually meeting Dr. Weber and the way that he primarily spoke to Mikkel and made sure she understood what the entire process was going to be. And she had a high level of comfort with him. She very much appreciates adults who treat her like she's 13, as she was at the time, as opposed to just a child who's with her mom who's going to pay the bill. As a parent, you're always nervous about, but with it not being a general anesthesia, that made me feel better. I was a little worried about pain management after, but I've had enough procedures, not plastic surgery type procedures, but just health procedures, to know that she's pretty tough and she can handle most things. She had no reservations. She was excited to have it done. She had some minor concerns about what the pain would be like. And then after, she thought we were all being silly because it didn't hurt at all. She barely used any of the pain meds, even though we were told she was supposed to use them to keep the swelling down. She's like, I don't need them. I'm like, but you're supposed to take them. And the only thing she complained about, so everybody knows what it may be like for them, was the Q-tip bandage that they put. It itched and it bugged her, and she wanted to pull it away from her face, and I couldn't let her do that. But other than that, she's like, this is so easy, it's a piece of cake. The day of the procedure, I was trying to drill down on how she was feeling emotionally, her level of anxiety, because that was something that your team talked to us about, like how they can manage anxiety and possibly give some sort of a medication. She was too young to be prescribed something for us to give her at home. So then I was a little anxious about that. She was actually not anxious. She just wanted to get it done. So that was more like me being protective mama. And she was just excited to get going with this thing. We felt very supportive throughout the entire process, every step of it. I feel like we developed some good relationships with the people that work here. Dr. Weber continued to be very focused on treating Mikkel the way that she preferred to be treated, as more adult-like than possibly her teenage years would suggest. They answered all of my questions very easily, very thoroughly. I think that's always a big thing as a parent. You want to make sure you know everything that may possibly happen. So we felt very supported throughout the entire process. The results that we have seen from this procedure, to put it very candidly, our daughter calls it her glow up. She started wearing contacts. She got her ears fixed. That's what she says. We addressed some light acne that she had. She just really, I'm going to go right into how we've noticed her level of confidence changed very significantly. Our daughter was very confident up until she hit middle school, and then lost a lot of confidence. She never talked about being bullied, but kids, can say things and they maybe don't even realize you hear. And now she wears ponytails. She's active in volleyball again. I think she stepped back from that because she didn't want to wear ponytails. And now she's going to club volleyball 3 times a week and wearing her hair up for events. And she's just generally standing taller and more confident, she's happier with how she looks. She actually thinks she's pretty now, which I always thought she was. But the advice I would give for a parent who has apprehension about having this procedure done for their child is, I feel as though the confidence that our daughter has gained has been immeasurable. It was a challenging thing to broach with her because she hadn't mentioned it, but once we got past that, it just really has changed her entire outlook on things. And I'm not saying physical appearance is the most important thing, but if it is the one thing that you as a teenage girl point out every time you look in the mirror and you hate to look in the mirror, if you can fix that for them, then you're changing the whole trajectory of how they're growing up. That sounds a little extra, but in our experience, that's how it was for our daughter. She entered high school very much more confident than her entire middle school career. So I would suggest that you do it. And from a healing point of view, it really wasn't anything bad at all, at least in our case. She didn't exhibit much pain and just the irritation for having to wear the bandages and looking. I would definitely recommend Dr. Weber and the rest of the staff here. For all the reasons I've already stated, they're professional, warm, caring. They spoke to our daughter with respect. It was about her. And they did a fabulous job. I guess I buried the lead there. Her ears are amazing. They turned out so natural looking. They didn't do too much. They didn't do too little. It was exactly what we had been hoping for, and we're all very happy with how she looked.